Good morning, everyone. How we doing? Yeah, you all see, I like that energy that everybody walked in. Everybody was so ready for this Friday, even though it's feeling like -12 out there. So my name is Lauren Stairs. I am one of the public health education coordinators for Schenectady County Public Health. I started at the health department in July of 2018, and prior to my arrival, the department became a registered opioid overdose prevention program through the state. So we are able to train community members, community-based organizations, and different types of people out in the community. And I started doing this day one, as soon as I started. So can I have a show of hands of how many people who have had a Narcan training before? Okay. Just shout out, how long ago was your training? I'm just curious. A year? Two? Four? Okay. All right, I just like to get a feel for the room. So today we're gonna, hopefully it's not taking 45 minutes, I'm supposed to take 30, so someone bring the cane and pull me off the front if I'm going over. We're gonna talk about the impact of an overdose and the difference between opioids and fentanyl. We're going to talk about how to recognize the potential sign of an overdose, and I'll go through some symptoms you might see from somebody, but this does not mean that this is always how it might look like or is across the board. These are just some things to keep in mind. And then we will talk about how to respond, how to use the naloxone, Narcan, those are the same things, and then also the Good Samaritan law. So I am going to pass out now a sheet that I am required from New York State Department of Health to pass out to everybody and have you fill in. It just asks your name, birthday, and a few identifying information, and I will get that from you at the end of the training. And everybody at the training today is welcome to a Narcan kit if they would like it. You get a kit, and you also get a little blue card that says you completed the program and you are certified, but you do not have to take a kit. And by me taking this sheet back from you individually, at the end I'll be able to mark if you decided to take a kit or did not. So what are opioids? They're a class of drugs to reduce pain, and they are prescribed by a doctor to treat moderate to severe pain. However, they are a medication, so when they are taken not as prescribed, they can have adverse side effects. So some common types that I have up there are Oxycontin, Vicodin, morphine, methadone, and different kinds. So this is something that you could be prescribed and take home with the oversight of a doctor. So then what is fentanyl? Fentanyl is a synthetic opioid pain reliever that has 50 to 100 times the pain-killing power of morphine. So it's very, very potent. Fentanyl, when it is given to you, it is given to you, thank you so much, to treat some breakthrough pain. So that's pain that you might have been given an opioid and you are still severely uncomfortable. And you're in a lot of pain. We don't want you to be feeling this way. So they will prescribe you fentanyl. However, they're not going to keep you on fentanyl for a very long amount of time. It is just really to make you more comfortable, and we're going to ease you off because eventually we want you to not need anything to feel comfortable. It has a very rapid onset, so it's hitting you very quickly because you're in a lot of pain. So we want to make you as comfortable as possible as quickly as possible. And then it only has a short duration because we don't want you to be on this for very long. So when you are being given this by a doctor, you're not getting a large dose. However, in 2013, it started being mixed illegally with other substances, and we have seen it in heroin and fake pills. So this is a chart, if you can see it, and I'm sure a lot of people in the room are familiar with the statistics that we've been seeing with overdose-related deaths. And this chart just shows, it's from 2000 to 2016 from the CDC, that our fatality rate was going up due to opioids and having an overdose, which is why we're trying to get this life-saving medication out there, and different programs are working to get that out there because we don't want to lose anyone else. So every quarter, the New York State Department of Health, Public Health runs on data. So I had to show it. So New York State Department of Health comes out with statistics every quarter on just what's going on in every county. So if you were interested in what's going on, you would be able to look at this. It's all public information. So this chart shows opioid overdose outpatient ED visits. So that means it's not necessarily fatality. It's just somebody who had experienced an overdose and went to the emergency department. So green is all opioids, and then the blue is heroin, just to show the difference of what's been happening. And the latest data point we have is from January to March of 2019. So everybody can see that. And then the next one is clients admitted into treatment facilities. And again, green is any opioid, and then the blue is specifically for those admitted for heroin. And since I have been training, this has been pretty stable and stagnant, which is like, we know people are in need of treatment. We also know that sometimes it's hard to get people in treatment, but we haven't seen a huge increase because we know we don't have big treatment facilities popping up left and right. It'd be great, but we don't. But we also haven't seen a big decrease, which is good. So it's not like people are stopping and not going. And then this graph I find very interesting, and I like seeing this. This is for naloxone administration, specifically in Schenectady County. So if you were interested in how much Narcan was being administered in any county, you could pull this chart. Again, you have to kind of take the data with a grain of salt because it's only who's reporting back to the state is where this is coming from. So the red line is EMS, which if someone calls 911 and EMS comes on the scene, they are going to be the ones who do anything that's medically necessary. So they have the highest. Then blue is law enforcement, which is lower because typically if they are responding to something, they are tag teaming with EMS. And then the purple is programs like mine. And I cannot take credit and say I have trained every single person who's a community member in Schenectady County. There are other programs within our county, and this just shows that it's working, at least, that someone was in need and needed Narcan, and a community member who was trained through a community program was able to administer. So it's really important to report that, and we'll talk about that later. So that's just some data. You guys still awake? Okay, good. So this is just to kind of talk about what's going on in the brain when opioids enter the system. So there are opioid receptors throughout your entire body. There are a large majority of them in the brain, which happen to live in your respiratory center of your brain. So when the opioids enter, they need to go find the receptor that they fit to. So they go and they float around and they find the ones that are in your brain. And because they're in your respiratory center, when there are too many opioids in that area, now our body isn't sending signals to the rest of our brain to say we need to breathe, because all those opioids are sitting on top of them, like that. So that is that's your brain. Very scientific, but it's just to show that those are the receptors and the opioids come and they sit right down. So when they're being covered, now those opioid receptors can't send signals to say, hey, my body needs to breathe. So the brain is doing everything else it has to do to keep your body working. And it's just like, I haven't gotten any signals from the respiratory center and they're not talking to me, so they must be fine, because how else is the body going to know? And that's why we see people go unconscious, because that's just so happened to be how the opioids work and where they find their home. So a progression of an overdose. If someone was to overdose on heroin, it's not going to happen immediately. It could happen in 1 to 3 hours, and this is all dependent on that person's body makeup, their tolerance level, what they took. All of us are different, and all of our bodies react to drugs and other substances differently. Some of us have allergies to some things, and some of us don't. We're all different. So those overdoses, specifically for heroin, rarely happen immediately. However, if there is a fentanyl in anything, an overdose can happen within minutes. Again, depending on that person's tolerance, body makeup, all of those things. But the reason why the fentanyl overdose happens within minutes is because fentanyl, when it's prescribed by a doctor for your breakthrough pain, it has a very rapid onset because it thinks your body's uncomfortable. I need to make you more comfortable. So fentanyl doesn't know when it enters your body, was this prescribed by a doctor and measured out by a pharmacist, or am I just home? Fentanyl doesn't know that. So it does what it's supposed to do and gets into your system very quickly. And typically, when it is not taken as prescribed, as with any other medication, it's typically too much, and your body is not ready to handle that. So when someone is going into an overdose, these are just some things to keep in mind. This is not every single person, but a person who is experiencing an overdose early on will have heavy, uncontrollable nodding, loud, gurgled breathing, because remember that the respiratory center isn't talking to its brain. So the body is now doing everything on its own without help from the respiratory center to just breathe. So your body's just doing everything it can. So eventually the heavy nodding, gurgle, loud snoring sounds are going to stop because now the body is exhausted and it's not getting any air. So then someone stops and they go unconscious. Does that make sense to the group? Okay. So risk factors for an overdose. So there's loss of tolerance, mixing with drugs, and using alone. If anybody is ever to use a substance alone, they have the highest risk for it to become fatal because who is there? No one. They're alone. So it's really important that people reach out to other people check in on other people too. We're a community, we need to reach out to our other peers. So that is the most dangerous because no one's there to do anything. The next one is loss of tolerance, which I personally did not know this fact until I became trained by the Harm Reduction Coalition. And with opioid use, if you stop your use, your tolerance can drop to 0 in as little as 72 hours. So before I got trained, me not having a lot of experience in this field, if I'm being honest, to begin with, I was kind of thinking that opioids, aren't they the same maybe as like alcohol use? You can have a glass of wine or a beer, and you have that every day, and then you stop for a few days, and then if you have the same amount, maybe 2 days later, it doesn't hit you maybe any differently. You might still, I for one would probably need a day off. That would hit me too much, but I'm different than you are. But it's really not that big of a difference if someone stops for a day or two. With opioid use, it's very important to keep it in mind if someone isn't using for a few days because the body has just flushed out all of the tolerance it built up. It doesn't care how long it took you to build that tolerance up or where that was. It flushes it out completely. So it's very, very important to talk about this and also to bring up different plans for relapse in case someone does slide back because I don't know about you, but in January 2021, everybody makes New Year's resolutions, right? And there's relapse in that. So I'm trying to drink 8 glasses of water a day. That's tough. I've had coffee this morning, so that does not count. So that means today I'm not doing so great, but that doesn't mean tomorrow I might not be. It's a behavior change that we're working on. Same thing with trying to successfully be in recovery. It is a behavior change and it takes time, and we just need to be honest with ourselves and just really be aware of this because the 72-hour loss of tolerance is huge. And then the next one is mixing with drugs because no drug is supposed to go with another drug. They are made differently and they are meant to have different reactions. So if someone mixes one substance with another one and they have a fine reaction, that doesn't mean necessarily that you will too because we're all different and we all react to drugs and other things differently. So it is never good. So then, context of an overdose. So typically there is somebody somewhere who could do something. However, it's a very, very scary situation. People don't want to get in trouble. They don't know what to do. They're just unsure. So some people might do things like letting that individual sleep it off. They might give them a cold shower. They might try to do something else. And then they might not call 911 to get other professionals on the scene because they don't know what's going to happen. But it is always okay to call for help. Because especially in this situation, even though I'm a trainer, I'm not trying to be the expert. I want other individuals who are trained in the medical profession to do this. So prior to needing Narcan in a situation, because everybody who is trained in New York State gets trained through the Harm Reduction Coalition, let's talk about some harm reduction techniques. So before needing Narcan, it's really important that individuals do tester shots if they are going to use a substance and go slow. Because once you put a substance in your body, regardless of what that is, it can't come out immediately. It takes some time. So if someone's going to have an adverse reaction to something and they took all of it at once, it's not going to be so great for their body. It's also very important to take turns and not use alone. Taking turns more or less, because if 2 people use a substance and they both have adverse reactions, who's going to do anything about it? There are also things that are fentanyl test strips that individuals can use to test their substance before using it. It will not tell you how much of fentanyl is in the substance. It will just tell you positive or negative. And then you can make a better choice about what you're going to use and use safely. And then never delay calling 911. And also have naloxone on you because we'll get into it, but it is the best thing out there. So what is this? So naloxone, Narcan. It is the only drug that can stop the effects of an opioid in the system, regardless of how that opioid entered your body. And it will push the opioids off the receptors for 30 to 90 minutes. Now you get a 30 to 90 minute range because we're talking about everybody's different. Everybody's unique. Everybody reacts differently. So you get a range. We can't guarantee that if you give someone naloxone, Narcan, that that it's going to work for 30 minutes, or that it's going to work, for 90 minutes. It might only work for that 30 minutes. So here is a graph to show. So on your left, the opioid is on the receptor, right? And it's sitting there, and it's having its great time, and it's got its blanket, and it's all curled up, because that's what it's meant to do. It has no idea what else is going on around it. But now I'm not breathing. So someone administers naloxone for me, and it enters my system. So the naloxone is on the right now, and it pushes the opioid off the receptor. So I have a quick quiz question, kind of. Does the naloxone in this picture look like a Pac-Man or Mrs. Pac-Man with like a mouth? Does it look like it has a mouth or anything? No. So the naloxone isn't Pac-Man. It's not eating those opioids and getting rid of them. Naloxone is only concerned about shielding the receptor. And it's shielding the receptor in the respiratory center so now my body can breathe. Thank you, Narcan. However, in that 30 to 90 minutes, because naloxone is not Pac-Man, we're going to come back to this picture over on the left. Does not necessarily mean someone is going right back into an overdose because who knows when that substance entered their body, also tolerance, all of those things. But they do have a high chance, so we want to monitor. We don't want to just leave them. We don't want to administer Narcan and say, okay, Lauren, you're good. See you tomorrow. No, please do not, and we'll get into that. So does that make sense to everybody? Okay. So, naloxone in action. It causes absolutely no harm if an opioid is not present. So I could administer Narcan to myself right now. I will not. That would be very wasteful. And I would still be talking to you. You'd still have this training. And we'd still be starting our Friday morning off. So great. However, if there was an opioid in my system, you just saved my life, so thank you, and now I can breathe, and the only thing that will happen is I will be going into withdrawal instantly because the naloxone pushed all those opioids off. So I am not having any effects from those opioids. So I'm going to probably not feel so great, and there is a high chance that I could get sick, and we'll talk about a position that's safe to put someone in. And the naloxone is going to work again for 30 to 90 minutes, so I could be breathing for that period of time. And when naloxone enters an individual system, it can take 1 to 5 minutes for that person to wake up. Because it is a medication, you got to give it a little bit of time. So, if you take an Narcan kit from me today, which again you do not, no pressure. If you decide 2 days from now that you're like, oh, actually I would like one, we can get you one. If you decide 2 months from now, oh, I would like one, we can get you one. So what comes in your Narcan kit is 2 nasal sprays, gloves, the medication instructions, alcohol wipes, rescue breathing mask, and instructions. So you get a nice little goodie bag. Mine is very loved because I never go anywhere without it. So that's what you get. So now we know what's going on in the system. We know how the Narcan's going to work. But, okay, Lauren, what happens if I think someone's overdosing? What do I do? Do I just go right up into their personal space? And how do I use this? So what you want to do is there are some steps, and the beginning steps are more for your safety, because if it is not safe for you to respond to someone, we do not want you to. Just call 911, because if you enter an unsafe situation, now we have 2 people that could be harmed. So there's the shake, shout, sternal grind, call 911, give naloxone, further resuscitation if needed, and you care for that person. So shake and shout is literally what it sounds. You can shake the person and shout. And I could be sitting in a chair and you could shake me by my shoulder and say, Lauren, I'm going to call 911 and I'm going to give you Narcan. So if I was sleeping and I was a very loud snorer, you probably just woke me up. We're good. We can have a conversation. If I was actually experiencing a very nice high per se, and I hear that you're going to give me Narcan, I'm most likely going to say, please back away from me. Because that person might just be fine and relaxing and sitting there, and they're still breathing, they're still functioning. So that's why you want to make sure that you just make sure where that person is. If they do not respond to that, you can do the sternal grind, which is you take your knuckles and you go up and down the breastbone, and it is very uncomfortable. This does not mean you need to do this to everybody, but it's just kind of if you're unsure. And then after that, if that person is still not responding, you want to give naloxone and call 911. And you want to do whichever you can first. So like my Narcan's right here, and there's a room full of people. So I could start administering my Narcan and say, hey, someone else call 911 and tag team that. So giving this naloxone. So it comes in your kit, and it's a nice little nasal spray that has this nice little silver packaging. And I don't know about you, but when I first saw this packaging the silver part reminded me of Dayquil and NyQuil. And I was like, how am I supposed to open that? I can't open that stuff on a regular day. Like, that's ridiculous. Don't worry. I panicked for you. It is so easy to open. So there's this little peel back. It says peel here. And what you do is you peel it, and it opens. As soon as you open it, please use it because it will not be sterile for somebody else. And we don't want you to open it and then put it in a baggie and hope that maybe it didn't get pushed and do something and now you're out of a Narcan kit when you really need it. So if you open it, please use it because you in your gut thought you needed to use it, so just use it. Peel it back. This part goes in the nose, and there is a small plunger that releases the medication. So it is a liquid nasal spray, so when you are administering this, you would want that person's head to be slightly tilted back. Because if their head is like this, you're going to squirt it in their nose, and it's going to come right back down. It's not going to do anything for me. So this goes in the nose, and you have the plunger. So you want the thumb on the plunger, in the nose, tilt the head back, and you click, you go squirt, and it makes a click. It does, very light, and you take it out. Done. That's it. And now you just administered Narcan. You want to wait 2 to 3 minutes because it takes 1 to 5 for it to get into somebody's system. It absorbs through the nasal membrane, so it takes a tiny bit of time. If someone does not respond from the first dose, you have a second dose. You take that guy out. You would do the same thing. Peel it back. This goes in the nose. Plunger releases the medication. You want to do it in the other nostril because maybe there was some reason that this nostril was really blocked. Tilt my head back, put it in the nose, click, and take it out. 1 Narcan per nostril. And you can never give somebody too much. But the 2 that you have should be good. And also you're waiting that 2 to 3 minutes because once you administer in one nose, if you go right into my next nose and I'm middle of waking up and now you're in my nose, and that's just, you want to give the person space. So not too scary, right? All right. So then you want to put the person in the recovery position because their body is limp. They don't have any control of what's going on. And if a person is sitting, say, even in a chair like you guys are, there's no arms or anything, I could fall off the chair, I could bang my head. And also, going into withdrawal, if I'm going to vomit and I'm not in a safe space for that vomit to leave my body, I have a very high chance that I could now choke on it. And we don't want that either. We want them to be as safe as possible. So after you give the Narcan, if you're waiting for EMS to come or in between, you are welcome to do rescue breathing because that person does not have any oxygen in their system. So any period of time that they do not have oxygen, anybody does not have oxygen entering their body can cause serious brain and nerve damage. So we want them to have oxygen. Now CPR rescue breathing is not going to bring me back to breathing. It's just going to help, hopefully, with the rest of my body to not have as much damage in the end. So if you're trained in CPR, you're welcome to do that. Everybody has rescue breathing masks in their kit. And what you do is you check to make sure that the airway is not blocked. You want to tilt their head back and you pinch their nose and you give 2 quick breaths to make sure that their chest is rising and falling. If it is not, you want to retilt their head and you want to recheck their airway because I don't know if you've taken CPR classes, but even the dummies, their necks can get all weird and they can't get the right airflow in, so you want to really make sure. Once you have the airflow correctly, that their chest is rising and falling, you want to give 1 breath for every 5 seconds. And you want those to be normal breaths, because if you're like even that is tiring. You want to be normal breaths because we want you to be able to last and do this for as long as possible. So after you give the Narcan, the person will wake up, and you want to explain what happened to them. And you want to be as calm as possible. I think everybody in this room is really good at being calm, because that's why you're in the line of work that you are in. Because if you aren't calm and you're all the way up here panicked, then that person is rightfully going to join you right up there. And we want to make sure that that situation is not elevated. So you want to explain what happened to them, let them know that there is Narcan in their system. Somebody might feel, well, wow, I feel really crappy right now. I might have more of a substance. I'm going to take some more because I feel terrible. If anybody is to take more of that substance, remember, Narcan's in their system for 30 to 90 minutes, completely shielding all of those receptors. So if anybody takes more of a substance, that opioid is just going to bounce around and not go anywhere until the Narcan has worn off. And then it'll come down to the receptor. But if someone has already overdosed on what they had in their system and then they took more, they are very likely going to go back into an overdose again, and we do not want that to happen. So if EMS was not contacted, please call them immediately, because, again, I'm not trying to be an expert. I want other people with me to help with the situation, because we need that person to be checked out and make sure that they are okay. And it is very important that if they do go to the emergency room, even after that, that they follow up. Try to, if you can have a conversation with them, that they follow up with their primary care doctor, because this is a medical emergency, as with anything else. If you had an asthma attack and you went to the emergency room, you should follow up with your primary care. Same thing with this, because we want to make sure that that person is safe. They weren't breathing for who knows how long, even if it was a short amount of time. So we want to make sure that their doctor is aware. So, final steps, you would report your use of your Narcan to me if you did take a kit from me today and you use it later on. You want to report that you used it to me. I have a form that I fill out. For the state, it asks absolutely nothing of you. It just asks where did it happen, zip code, if you know male or female, if you know how old, how much Narcan did you give them, and did EMS get contacted? What did that follow through look like? And then I would say, are you free today? Because I would want to then meet up with you and make sure that you have a full kit on you at all times, even if you've used one of these. I've had people who only used one. I've had people who used a whole kit and then was like, oh, I don't really think it was an overdose, but I used it anyway. I don't care. I would much rather you use it than not use it. Also, if you use Narcan and that person was suffering from another different medical emergency that was not related to opioids, you didn't just make their situation worse. You don't have to worry if they were on other medication, if they suffer from any other chronic conditions. You won't make it worse for them. It is always best to use it, because if it is opioid related, you just probably saved their life. Gotta go quick because I'm a little over now. So storage, you want to keep it at room temperature. It is a medication. Cooling and heating will affect it. So don't leave it in your car from January to December of this year, because we get a lot of weather lately, so our temperature changes. And then Good Samaritan Law, just quickly, I have handouts on it too. This protects the person who has overdosed and the person calling 911 from any further prosecution, especially in situations where there might be other illegal activity going on. Does not mean that you're going to not go with the police and get questioned, but there's no prosecution for those individuals. And also, if you were to use Narcan on someone and you found out that somebody did not want that was not their wishes, there's nothing that can happen to you because you are acting as a good citizen. How are you supposed to know what their wishes are if you just met them? And then the pharmacy, so there is the naloxone copayment assistance program through New York State. So pharmacies have a standing order to dispense Narcan. And through this program, it will cover a copay up to $40. So if you have health care coverage and it has prescription coverage on it, you could go to the pharmacy. I have a list of the ones in Schenectady County that we have called, and we know that all of the farm techs and pharmacists are very well aware of this. You could go up, hand them, say, I would like some Narcan, please. Hand them your insurance card. They would run it. I don't know about you, but if I thankfully have not needed any antibiotics lately. But when I go, it might be like $20, $25 depending on what the antibiotic is and my copay. But with this, it covers a copay up to $40. So that means I didn't pay anything, and I can have Narcan. So now cost is not a barrier. So that's a great option for people on weekends or if they don't want to come to a training. I have trainings every second Wednesday at Ellis from 9 to 10, and that is open to anybody can come to it. I also told Aaron that if you know of anybody in the community who would love a training, 5 people or whatever, I will have a very casual training with them. I don't want this in my office. I want it out in the community because what good is it doing me? But the NCAP program is just another area. And then also if you're not using your medications, please get rid of them because they're not doing you any good. If you were prescribed them 5 years ago, they're not going to react the same way they would have 5 years ago. So don't save them for a rainy day. Get rid of them. So there are some drop boxes, Niskuna Town Hall, County Sheriff's Office. And then this is just some resources. So there is the number you can call 24 hours, 7 days a week if you're looking for treatment, regardless of what it's for. And this is a great number to kind of know what's out there because everybody's recovery is different. Everybody wants to experience their treatment differently. Some people want really intense. Some people want very casual. I'm not ready. I don't know. So this is great. And there are handouts on that. And then these are just some resources. So harmreduction.org at the bottom has a lot of cutting edge things because they're making sure that we are being aware of people's needs and helping people get through this. And then this presentation was brought to you by New York State Department of Health is where we're certified, and then the AIDS Institute is where I get my Narcan from. And then Harm Reduction Coalition is the majority of the information on the slides you saw today and my training. And that is my contact information. So